we are here post-operative day 1. So I wanted to show you some things. So the patient had a lower facelift, and then we have also done Renuvion to the neck. And so here are the hemostatic net sutures. Okay, this is the appearance that they look like. You can see it looks like a net that goes all the way along the neck. And then here's the incision line for the facelift. So here around the ear and then back into the hairline here. And then the patient also had an upper blepharoplasty, so you can see there. Close your eyes just gently, right? Okay, and then the ends of the sutures have this tape on them. And then the other thing we did that was interesting was we did a dermal ablation around the mouth for some deep ridage. So this basically takes off the first layer of the skin and goes into the dermis. And so this will require some care until it gets reepithelialized or the new skin forms over. So I'm going to show you the laser gel that we use for that. So here's the laser gel, and it's an antibacterial laser gel, and that will go around. She also has some vinegar soaks that we're going to use, plus antibiotics and an antiviral. So all of those things get used. This is post-operative day 6. We went ahead and removed the sutures that go here and the sideburn area in front of the ear, behind the ear, and then back into the hairline here. The upper blepharoplasty incisions also came out. And then the hemostatic net sutures we removed last time at day 3. And then, of course, we don't do this on everyone, but she had the dermal ablation. So you can see things are starting to heal, and she's starting to get some reepithelialization in some areas, but not all yet. But this looks typical for the resurfacing that is done. So overall, she's doing great. She's looking good. She's doing all the care for the resurfacing. On here, we just have apply a little bit of antibiotic ointment once or twice a day. But at this point too, for any types of lumps and bumps in the face, what we have done is we do some light massage, and actually heat works out good now. We are about 3 weeks after surgery. You can see everything is healing well. Close your eyes just a little bit. There's the blepharoplasty incision. That's doing quite well. Let me get you in here, and this is the areas of where the facelift incision was at, and that's also looking appropriate for a 3-week mark. And then the other thing that's would be here is the dermal ablation, and you can see here still pretty red, but the new skin has all grown over. All right, the thing that takes the longest here is just the redness. Sometimes you can feel a little bit of lumps and bumps and some firmness here, and those will massage and work on that. But on hers, not particularly anything of real significant, just the normal type of things that we see immediately after surgery. This is 2 months after having the lower facelift, use of Renuvion for the neck, the upper blepharoplasty, and then also we did the dermal ablation around the mouth. So at 2 months, everything is really healed up pretty nicely. Still a little bit hints of red from the dermal ablation that we did, and you can see the incisions are still a little bit red too. So all of that is pretty normal. Close your eyes just gently. You can see kind of the incision there, but everything's healing up great at this point. All we really need to do now is just continue with the Silogen for the scarring, and it's just time. It may take up to 6 months to have 100% of the swelling out, but by 2 months, significant amount of the swelling has already been resolved.